I hope you'll be patient and bear with me. I'm delighted to be here today to talk about consulting for growth, scaling social innovation. And we have four great panelists joining me. We're not going to use up your time reading off bios because you all can read pretty well. But Saul Kornik, Sivan McLetchie, Violetta Osifin, and Ken Berger are going to spend some time talking with us about their experiences working with social enterprises, working in the not-for-profit sector, and this huge issue of scale. I was at the Skoll Forum last year, and scale seemed to be one of the buzzwords that everybody kept talking about. Scale, scale, scale. Everybody wanted to grow. Everybody wanted to grow fast. But we want to dig in a little bit and talk about the why of it, not just assume that that's what everybody should be doing, but talk a little bit about the motivations, when it's right, when it's not. So let's take a few minutes to start out by hearing from each of our panelists, just so we understand the background, how they got here, and what experience they have personally with this issue. So Saul, do you want to start us out?
Thanks. I got here on an airplane from South Africa. I'm a case study from on the ground of what's going on in healthcare in South Africa. I run an organization called Africa Health Placements. I was involved in starting it up. We're trying to address the shortages of human resources and health in the region. Southern Africa, or sub-Saharan Africa, has about 20% of the world's population, but only 2% of the world's physicians. And the anecdotal stories that we're seeing as we're traveling around to various hospitals pretty much supports that. You've got children dying from diarrhea, where all they need is some antidiuretics, but there are no doctors or nurses to deliver the medication. We've got patients traveling a full day to get to a hospital, where they then wait in a queue the following day to see a doctor because there are just no doctors around. And this costs them a lot of money to take the time off work and the time for transport. So there certainly is a demand for our services, which is firstly to recruit and place in these hospitals, and then to deliver solutions to governments and regulatory bodies around how do you streamline your recruitment process, how do you improve your human resource systems to make you competitive for these human resources that are scarce worldwide and that are mobile and can go wherever they want to go. We started this thing about 4.5 years ago, or 5 years ago, and at that point it was just me and a recruiter. We were working in one province in South Africa. We had a budget of about $30,000 US. The government hated us because we were showing them up for not doing a very good job. We were working out of a garage, and we were just recruiting some foreign doctors. And today we are an organization of about 40 people. We are in 8 countries and 11 different cities. We've got a budget of about $2 or $2.5 million a year. And we don't just do recruitment, we do a whole host of human resources solutions and services. And the path from there to here was an interesting one. And there were various issues we encountered in scaling up our operation to get to where we are today, and we're facing challenges as we try and scale from here. Just very briefly, the things that we went through. First of all, we felt this political pushback because we were showing up governments for not doing their jobs in terms of staffing in hospitals. We then had internal governance issues once we managed to get operating. Once we sorted out those, we formed a merger, and there were cultural clashes internally in the organization from the two different groups of people in the two organizations that had come together. Once we'd sorted out our staffing issues, we had problems with the processes and systems to kind of operationalize a bigger operation, whereas before there were just a couple of us who knew what was going on. And now that we've sorted out our processes and systems, we're at a point where we are ready to go, but we are lacking a few key resources to go there. And I'm hoping to discuss more of that today. Thanks, Jeff.
My name is Sivan McLetchie, and I'm with the Bridgespan group. Unlike Saul, I did not get on a plane to get here, but I took a cab. And you can't hear me? Okay. Is this better? Great. The Bridgespan Group is a nonprofit strategy consulting firm. We were founded 10 years ago with kind of a combination from Bain & Company and a professor from Harvard Business School. And they saw a need to be able to take the tools and the frameworks and the strategic thinking that the for-profit sector had been using for years and apply that to the nonprofit sector. And that is at the heart of what we really do. We've done a lot of work with clients around growth strategies and around scalability, both from the kind of the perspective that there are way too many nonprofits out there, and from a kind of an efficiency perspective, the money is not going where it needs to go. And yet there are no real capital markets in the nonprofit sector to be able to drive all these nonprofits to start merging. So we've been working on some of that lately. And unlike Saul, who gets to kind of see the world kind of on a day-to-day basis and the huge impact he's having, most of our work with clients deal directly kind of at the board and the CEO levels. So I'm not going to talk all that much about it, but I think you guys know what strategy work is at this point.
Thank you for the segue. I also won't talk about what strategy work is. I'm Violetta Staffino with the Boston Consulting Group, and we work with for-profit as well as social impact clients. So I actually would love to share some of the perspective of the parallels between the two sectors and how we take that virtuous circle of what we learn with our clients in for-profit and really transfer it to how we work with social impact clients and vice versa. And I think the subject of growth is one that we certainly encounter with both of those types of clients. And one of the case studies we'll talk about today is with Ken Berger's organization with Charity Navigator, and how embarking on the question of the direction of where the company could go and how far it could push on going beyond its core capabilities, and something Ken will speak about in more detail, really ask the question of capabilities. What is the right growth? So it's not really about just growth, it's about right growth and smart growth, and that's some of what we consult with our clients on, and some of the information I'll draw from today.
Hi, so I'm Ken Berger, and I'm a PowerPoint junkie, and since there's no capacity to put this on a projector, some of you may have this. If anybody wants it, let me know after, just leave me your card. But Charity Navigator has been around for 9 years now, and our mission is to be a guide to intelligent giving. And we were founded by a wealthy guy and his wife, who basically wanted to get objective information about charity performance, and they couldn't find it anywhere. Hence, Charity Navigator was formed. When we started, we had about 18,000 visitors per year on our website, where we rate charities from 0 to 4 stars. Today, we have 3.5 million unique visitors, and many more visits than that, and we're estimated to impact somewhere between $5 and $10 billion worth of charitable giving each year. So we're the biggest player in the space of rating charities that there is. So we have a problem. That's the one with the baby on it, for those of you who have it. And the problem actually was mentioned in the earlier session on social impact measurement, the problem of reductionism, the problem that our measures have basically focused historically on what we call now one dimension of charities, that is their financial performance, but have been silent on those things that we all believe are the most critical, what we call in English to our users, results. And we call it impact here, but it's the same basic idea. And so the challenge for us was to develop a model of what should we be measuring, and then how do we go about doing it. So the next slide is a formulation that was developed by a group called the Alliance for Effective Social Investing. And I recommend that you check them out. Their website is alleffective.org. And this is a group of leaders, thought leaders within the sector and charity leaders who basically said, what does it take to be a high-performing nonprofit? And this, which I will not go into because of time, is a summation of that. Next slide. So Charity Navigator aspires now to develop a model of rating organizations that fits within that framework. And the next slide is what we're calling a three-dimensional view, CN 2.0. And then the next slide is basically walking you through how we plan to get from here to there over the next couple of years. So now I'm going to just focus for a few seconds on 2 slides with bullets on them and try to explain what this means. There were 3 questions that were posed by Jeff for us to address, and if I can just give a preliminary response. Tensions between mission and sustainable revenue for us. First one I call the White Knight's Firewall. Donors trust us more than many others out there because we're an objective third party, hopefully. And so one of the places we could get revenue, a logical place, is from the charities we rate. Better Business Bureau does that. They charge a fee for their seal. But we have been told, if you want us to trust you, and you've seen the rating agencies in the for-profit sector and the trouble they've gotten into. So a logical source of revenue, we are not willing to broach the firewall to get that revenue. And it's a real challenge for us to find creative ways to try to do that, to get revenue in view of that, because we're completely free. We don't charge anything to charities or the people who use our service. The second challenge we have is what I call connect the dots. We're not sexy. We're kind of geeky, nerdy, numbery people. We don't house the homeless. We don't feed the hungry. So many people don't even realize we're a charity, and the idea that we have to say to them, well, if you fund us and if we can drive more money to high-performing nonprofits, then you will house more people and you will clothe more people. It's not as sexy, and you've got to be able to connect the dots, and it's a challenge for us to get that message out. Third, Jaguars and Viagra. We began trying to find new revenue streams. We began to put ads on our site. We had rigorous debates when the advertisers wanted to put Viagra on our site, for example. And so we did it anyway, and we haven't gotten any complaints from our users. As long as you stay free, you can sell Viagra. Do whatever you got to do. Just don't charge me a fee. Next one is blunt watchdog versus insiders. I ran charities for 30 years, serving poor people before I came to Charity Navigator. And I could never open my mouth. I could never speak to a group of you and say what I said in our private session, that most foundations suck in the way they measure. I couldn't do that when I was running a charity. A Charity Navigator as a watchdog, this has been therapy for me. I can say whatever the hell I want. And so there's a real difference between us and, let's say, a GuideStar or a Better Business Bureau that gets its money from the insiders. But there's also a revenue challenge. Because I shoot my mouth off, therefore, many logical funders are saying, he's crazy. I'm not going to fund that guy. He's going to say that about foundations. So there's a tension there for us to get revenues. And then lastly, what I call egomaniacs and fragmentation. There's an explosion of interest in impact measurement. And many people think they've got the one great idea. One funder that we have says every day somebody new is coming to them saying, I've got a way to measure this to crack the code. And with each increasing member of this group of sometimes egomaniacs that think they have the only solution, it leads to more fragmentation of very limited funding. And it's a real challenge for those of us that are in the space. There's very little money there. We're a $1 million organization at the moment. And still it's a real challenge. So last slide on bullets, and then I'll stop. Effective strategies to scale up. One, crisis is opportunity. When I got to Charity Navigator 2.5 years ago, the founder who cut the check every month for our first 6 years says, I'm basically out of here. I have to phase out for a variety of reasons. You've got to grow up and function like a regular charity. So this humongous part of our budget is disappearing. And so that was a challenge for us to really think through other revenue strategies and to scale up. We also did this streamlining to try to begin to get this new measurement tool in place. We've already started. We did what I call a one-trick pony, which basically was we went through our whole operation and we scaled back things that were not really providing a lot of value to get time available to put into this critically important core product of ours, which is the tool that we use. I also believe there are certain core values that are critically important if you want to scale up. The 3 core values we have, the first and foremost is to always be centered on the people that you serve. And whatever the heck your decisions are, you constantly need to keep going back. A lot of organizations get into this, groupthink. Second is a team model. Don't ever think you're smarter than everybody else. Don't be an egomaniac. 2 heads are better than one, and get as much information as you can. The Alliance for Effective Social Investing has been incredibly helpful to us in figuring out how to measure what matters. And then, related to that is continuous quality improvement. I welcome your criticizing me and telling me how terrible you think Charity Navigator is. I welcome that. The more feedback that we get, critical feedback, the better off we are. And that kind of dialogue will drive us all forward. Best stuff for free? Here's something I throw out to you, Columbia. One of the ways that we're going to scale up is we are going to use students. We are in the midst now, we got a grant for this to create a training program for students to do our measurement system remotely. And that we want to get to a scale where 85% of all the revenues go to charities. We want to cover all of those. We also want to give an opportunity for students to learn about what matters in measuring charities and to tell us what you think about it. Finally, elegant simplicity. In all of this change, we know part of the reason why we're so successful is because all the data shows something that was incorrectly stated in the earlier session. All the evidence shows that most donors are not interested in impact and measurement. There's a study by Hope Consulting that shows that. That is unacceptable. I agree. We got to change that. But what the study also showed from Hope Consulting is to get people this information, what they universally are saying, regardless of their income category, is they want it simple to access, easy to understand, and free. And so we have a star system. And even with this new rating, we plan to fold it all up into stars. About half the people who use this are drive-by donors. They give us 60 seconds. You've got to embed as much information as you can in as short bursts as you can. And that's part of our success, is to hopefully not make it reductionist, but to capture the information powerfully. And last, my enemy has become my friend. A few years ago, a number of the people that now fund us wanted to destroy Charity Navigator. And part of it was all these values and this listening that has changed the tone. And still, there's a lot of people out there that don't know about the changes that Charity Navigator is going through. And we think that the more that the message gets out there, that we're listening and we are wanting to change to be as rich as possible with information, the more our enemies will become our friends. And then the last slide just shows you how our revenue has changed in the past few years as we've been scaling up from sources other than the founder. The end.
Thank you for the express train ride through the world of Charity Navigator. I guess I'd like to start with Violetta and then Sivan. When clients come to you as consultants for this sector and they say, we want to grow, what's your reaction to that? What goes through your mind? What are the questions that are essential to ask at that point?
So usually when this conversation comes up, it's been within the context of a strategic plan. We're redoing our strategy and we need to grow. So the first question that we usually ask is why? What is the impetus for growth? What is causing you to think that you need to grow? And sometimes there's an articulate response that's close to, Charity Navigator, the crisis is an opportunity. Well, we need to grow because we need to think about how we can get external funding and how we can be relevant in this particular space. Sometimes it's because it seems like the right thing to do. So really thinking through why and working through, is growth going to help you to better deliver on your mission and who you are and the core of why you exist, is part of the conversations that we start from.
Just jotting down some notes. Organizations ask this question all the time, especially during kind of when they're looking at their strategy and they're saying, okay, well, where do we want to be in the next 5 years? And it's really fun and sexy to be like, yes, I'm going to take this organization and make it spread all over the world. We ask a couple of things on top of what Violetta already mentioned. Essentially, what is it that you're good at? Why is it that your organization should grow and deliver X, whereas some other organization that's out there already delivering X shouldn't grow? Why are you so distinctive? And then kind of, all right, so assuming that you're really good at doing X, what is it about that delivery mechanism of doing X that is effective? So is that magic dust that you happen to have that makes you so good something that could be replicable? Otherwise, you can only do it where you happen to be. And then kind of the third piece, which I think usually is the most important one in all of this, is what does your financial situation look like right now? If you think that scaling your organization is going to be a way of driving more funding to your organization, you're thinking about it the wrong way. You're thinking about it in reverse. First, you need to be able to have your funding in order. And then if you have really strong relationships with certain funders and growing is something that aligns to what they're interested in, then you can tackle that problem. I think one quick interesting fact is that, there are not that many really large nonprofits in the United States. And when I say really large, kind of over $30 million. But if you would take a look at those $30 million in annual revenues of those nonprofits, the majority of those have very streamlined funding sources. So it may not necessarily be one kind of foundation that funds them, but it will be one type of funder. So maybe all of their revenue comes from foundations, or all of their revenue comes from government, or all of their revenue comes from major donors. But they can really focus on one area of fundraising, and then they can align their growth strategy with what those funders are thinking about. If you look at some of the smaller nonprofits, because of their size and kind of where they are in kind of their growth plan, they will take money anywhere they can get it, which makes it really hard in that scenario to focus on growing.
Saul, some of the stuff that Sivan is talking about brings to mind our discussion the other day about, as you've thought about Africa health placements and how to grow, some of the pressures from the financial side and the conditions that you've had to deal with. Can you talk a little bit about your experience, especially with the finances, and how that's affected what you've done and what you haven't done, and what temptations there might be in that area?
Sure. At the moment, our biggest problem is actually finances. I really agree with what Sivan says about it's all very well to have growth plans, but if you haven't got the finances in place, you're doing things the wrong way around. When we started out, we got a bit of seed funding from through a company in South Africa who was trying to do some corporate social responsibility work. And as we proved that what we were doing was a workable concept, other donors became interested. But in time, though, we've actually managed to get money from one big donor, which is a foundation, and one big donor, which is actually PEPFAR, which is US government funding. Along the way, in looking for that funding, though, we had a couple of donors come to us and say, when I was presenting to donors, say, that's a great idea, you need doctors in hospitals, but we saw on the news today that you get this motorbike that goes off-road, and if we can brand our pharmaceutical brand on the side of this motorbike when it's traveling around rural areas, it will really give us a lot of exposure. And so, because we started out looking for corporate funding, there was a lot more pressure from corporates to brand things in a particular way or market themselves in a particular way. We started feeling pressure from the people we were approaching to change the mission of what the organization was about. They said, oh, you guys are about rural healthcare. This is also helping rural healthcare. And it required a lot of focus to make sure that we stuck on our path as a human resources organization and not as an organization that dealt in social development issues or dealt in infrastructure issues. So that's one thing. When we're looking for corporate donors, that created additional pressure, but looking at foundations gave us a lot more scope to do what we needed to do as long as we aligned our own goals with that of the foundation. We still feel quite a lot of pressure from PEPFAR in that we are allowed to provide health workers to HIV clinics, but we can't use PEPFAR money to provide health workers where children are dying of diarrhea. And so that's God, maybe. Maybe I got it wrong. But that seems to be what the pressure that's coming from PEPFAR. And also PEPFAR is a fixed... Okay, then our problems at the moment is PEPFAR is a fixed-term funding. It was always going to end in 2012, and so we're reaching the end of the funding period now. The foundation that funded us also funded us with the intention that we go out and find funding down the line. Their funding also ends within the next 5 or 10 years. So what we've started looking at now is how do we felt this pressure before of looking for money and being forced to do things that other people wanted us to do and us having to dig our heels in and as a result not growing too quickly. So where's our best source of funding that we can do what we want with? We can still be responsible, but we don't have to bend to the whims of other people. And there are two sources we're going after at the moment that seem to meet these needs for us. Because we've now got a good reputation and we've got some funding for the next 2 years before we run out, with which we can use that money to search for other money, we're going to go after individual donors. We looked at MSF's model where 83% of their $600 million annual budget comes from individual donors. And we have that sexy slant to AHP that Ken doesn't have with his organization. It's very easy to tell a nice story about a hospital doesn't have a doctor, and then what the impact of that doctor is after making a donation. So we're bending our branding in that direction now so that we can raise from individuals. And the other thing we'd like to do is we'd like to create a sustainable income source through profit activities. We offer a recruitment service. There are recruitment companies all around the world that make millions and millions of dollars every year from recruitment services. So we're now using that expertise to start a company that recruits other professionals, not doctors, because that would be a conflict of interest with our non-profit free of charge service, but engineers and accountants and scientists and epidemiologists and the rest of them. Charging a fee for companies in South Africa to bring these skills into the country, because we've got the experience in recruitment and we've got the experience in bringing people from overseas. So that's a little bit of a history and where we're looking to on the finance side of what's going on at AHP.
Violetta, I wanted to ask you to, as you're listening to what Saul is talking about and also from your experience working with Ken, what parallels, similarities, and dissimilarities do you see with for-profits and your experience with the for-profit world? Where are the lessons that can be applied to this kind of situation?
Definitely some parallels. I think that one of the realities is that not-for-profits or social impact organizations are being run more like businesses these days. And so the vice versa I talked about earlier of learning from profit to for-profit and back and forth. I think some of the parallels, you have investors who are creating pressures in the for-profit world, and in the not-for-profit world you have foundations that you need to respond to or choose not to respond to and react to from their pressures. And you also have the pressures of your customers in a similar way. So for Charity Navigator, your donors and what they're looking for and what they expect from what Charity Navigator stands for is something that you need to be true to and be true to your brand in a similar way. I think that there's also a parallel in terms of needing to be relevant. So if you want to be able to compete in the space, so to say, for-profit companies, obviously you're looking to compete, and growth would mean being able to have an advantage to compete and do something better. Similar in social impact organizations, where when you look at what is your advantage if you're going into a space, and probably even more so, I would say the bar is higher, because if you're both working toward a social mission, then do you really want to eliminate a competitor who's doing just as well responding to that social mission? Only if you believe you have an advantage and you can grow better or do something better should you look at it in a competitive way that way.
Ken, do you want to talk a little bit about your advantages and the ways in which growth would take advantage of those, as well as some of the opportunity costs of scale? I'm sure you've worked through some of those things as you've been doing your strategic planning, thought about the pros and the cons, the dangers and the benefits.
Well, the real big challenge for us is that I think I've touched on it before to some degree, that people just really don't see this kind of information as of critical value in many cases. And so for us to scale up, there's such, let me put it this way, if you had like a numerator that was the number of tools that are out there and your denominator is the amount of funding, the funding's flat, the tools are going up. If you have another one where the numerator is the number of tools going out there and the bottom is the number of people using this, the tools are going up, the number of users is remaining relatively flat. And so the big challenge is within that context, how do you, the real key for us is to get that denominator, in both cases, to go up, to try to breathe life into how critically important, and it's life and death for many people where this money goes, and that the vast majority of the money out there is going to places where nobody has a clue as to whether it's effective or not. I mean, it should be an incredibly compelling story, and but it's not yet resonating. We're in that early adopter phase, and there's this great chasm that breaching is really hard for us. I mean, it might have sounded like I was talking out of both sides of my mouth, because on the one hand I'm saying people aren't looking for this, and yet we have 3.5 million users. The fact is, if you factor in that there are about 100 million donors in the United States, put that in that context, there's a tremendous challenge and there's a tremendous amount of people that are flying blind. Some people have said that it's a rational choice that people are making. It's not that they're not interested, it's that there's just nothing out there. There's no valuable data. Finding a sweet spot where we can have rich data and also make it scalable across charities is a tremendous, tremendous challenge. And some have said it can't be done. I don't know if that answers your question, but that's the best that I can do.
That's all I ask is
Okay.
your best, Ken. Let's switch gears a little bit. We've been talking about finances. We've been talking about money. Let's talk about the human capital that growth requires. Saul, the human capital side of things for you in Africa would seem to be a big challenge. That's one of the reasons that the organization exists to begin with. Can you talk a little bit about how you've dealt with that, how you plan to reckon with it as you grow?
I mentioned right at the start that one of the key hurdles we already had to cross in growing to the size we're at today was one of people in the organization, the clash of cultures. And it was very important that we established what the culture of AHP was, and that people that didn't fit that culture were forced out of the organization. So I suppose that's the first thing I'd like to say. And it was difficult for me to do. I was on a learning curve myself. It started out with just me and another person, both of us very passionate about the cause, both of us working day and night for this cause. 2 years later, we inherited 6 or 7 employees who asked, well, what are work hours? And what are bonuses? And how many days leave do we get a year? We hadn't had leave for two or 3 years. We didn't have work hours. It was new. And at first I thought we could change the mentality of these people, but later on I realized that we couldn't. In South Africa, the laws are very, very strict about hiring and actually on firing, not so strict about hiring. We can hire whoever we want. So it required a huge amount of our resources to correct that problem. So the big lesson is don't be scared for us was don't be scared to get rid of somebody who doesn't fit with the culture that you're trying to create, and be aware that building the right team takes a huge amount of resources and it will pay dividends down the line. At this stage, our approach is we've got our culture right and we now hire professionals to do professional work. There seems to be a trend in NGOs, particularly in South Africa, where people, do-gooders, or I don't know, hippie do-gooders, some people call them, want to come in and go home at night and feel like they're doing a great job and pat themselves in the back and tell their friends about how great they are for the work that they're doing. But they may not be the best people to do those jobs. And we've developed a culture in AHP where if we have an operations team, which we do have, it's run by somebody with an MBA from Oxford. Our new business projects manager is an MBA as well. We've got 2 recruitment managers, a combined experience of 25 or 30 years of corporate recruitment experience between them. And this goes on all the way through the organization right down to the bottom. And so for us, I think the challenge as we scale up is in a resource-poor setting, how do we find the right skills that want to work in our organization, not being paid as much as you would get paid in a corporate environment, and to find sufficient of these people so that we can actually reach the scale that we're looking for. And that's a real challenge, particularly in South Africa, where skills are very hard to come by.
Sivan, what do you advise for companies and organizations like Saul's that are asking some of these human capital questions, given the scarcity of people who are willing to do what they need to do at that price?
It's a really big problem. I wish you luck. No. Kidding.
Let's go home.
It is pretty well known now that there's a huge leadership gap in the nonprofit sector, both in the U.S. and globally, especially when you think about kind of more senior level positions in organizations. And you find that more and more people who have grown up in corporate America are making kind of the jump and bridging over into the nonprofit sector, but there's still a huge kind of learning curve between kind of how you work in for-profit and how you work in nonprofit. the advice that I tend to give to organizations, especially when they come up with this question of, well, I want to scale and I want to grow, which means I'm going to need to recruit a heck of a lot more people, is, well, yes and no. You may need to recruit a lot of people, or you may not, depending on the model of growth that you tend to look at. So they're really kind of, aside from partnerships, which I would more often advise to do than any other growth model, there are really three types of growth that you can have in an organization. You can look at a traditional kind of growth model where you keep your governance structure in one central location, and you have kind of offices or branches all over the country that roll up to the head office, right? A traditional kind of corporate structure. You can do something that's more of an affiliate model, which think of it as kind of Boys and Girls Club, right? There's a national Boys and Girls Club, and then there are local Boys and Girls Clubs all over the country. Well, each of those local Boys and Girls Clubs have their own executive director, which means from a growth perspective and a leadership perspective, you need to make sure that you can find somebody to do that job in every single one of those locations. So that lends itself to kind of hurting that leadership deficit. And then the final model is a licensing model, which kind of goes back to some of these things that are getting pulled from the for-profit sector. And that is kind of less of a concern for the nonprofit, because there is an ED somewhere that says, I want to be licensed to be part of X organization. So the growth comes from the other direction as opposed from inside out. It comes outside in, because only when there's a strong ED that says, I want to be licensed to be nurse-family partnership, for example, is a licensing model. I want to be a nurse-family partnership organization. Do you end up growing? And so I think depending on the nonprofit that you're in, really understanding all of those options and understanding kind of where the leadership is in the places you want to grow, that can then end up driving some of the decisions you make in terms of growth.
So we've been talking for a little while now, and we were talking about how we wanted to structure the panel earlier, and I think we wanted to save as much time as possible for questions, just so we make sure we answer the questions that you have and talk about the things you want to talk about. So let's open it up at this point. I think there's a microphone that Liz has that will come wherever you are.
Of course, Jeff, you also said you weren't going to cold call on any of us. Do you remember that too?
Right, I remember that.
I do remember that. Yeah, so I'll let you volunteer to answer the questions. How about that?
Hi, my name is Daniel. I'm from the NYU Stern School of Business. Thanks for hosting us, Columbia. My question's for Sivan and Violetta. So I was working for a really large nonprofit out in San Francisco, and we engaged several times with big strategy nonprofit consulting firms who will go unnamed. I found this issue, this really troubling issue where the board and the CEO working at 30,000 feet would want to come up with these really visionary plans for growth and engage these firms and spend a whole lot of money and do some nice work, but at the end of the day, the firm would move on and do their next brilliant project. The organization is left with this fancy PowerPoint, and nothing really happens. So I blame the leadership and I blame the consultants altogether. But what do you what are the best practices engaged in doing these projects, or what do you advise these nonprofits? And do you know that these nonprofits are actually not going to implement these plans? That's a really cynical question, but
Okay. Well, so I have living proof that the plan gets implemented sitting next to me, so I'll take that question. I think that the way that we approach it, you're right. First of all, you should blame the leadership and the consultants for giving grand plans that don't get implemented. I think absolutely. The struggle is that sometimes the plans aren't grand plans, they're realistic plans. And what happens is that the organizations that we've seen get busy with other things. And so there really wasn't a plan for implementing the plan. That's where it falls short. It wasn't the idea itself or the plan itself. But the advice that we give when we first start working with organizations, it really is a realistic approach to things. It's not making it a grand plan. It's being inspired and visionary in where you want to go, but then really realistic with the resources that you have. And I think that's some of the human capital discussion we just had. I would actually bring it even further into not thinking about how are you going to get the resources for growth, but how are you going to maintain, grow, inspire, and bring along those who are already there when you're thinking about growth. And I think one of the major problems that happen is that you don't really have a plan for the organization to understand what the steps were to move you forward. And you don't have, so to say, a culture carrier or somebody who's championing an effort and able to, on the ground, move it forward. So I'd like to think that we're being and holding ourselves to high standards in terms of trying to get better implementation plans. And I do like to keep in touch and see how things do move forward. And I think I'll say it again. So with Charity Navigator, we started out, we gave a recommendation that to be able to move toward where the plan or the holy grail, as we had been calling it, of measurement was, it really was going to take 5 years to get there. And we had broken down the 5 years in 3 stages, and I think the 3 stages are now translated into these 6 steps, but Ken can attest to this. It's basically, it is still starting and saying, you need to break it down into steps. You need to get your organization there and be realistic about what you can do.
Some of the other things that we try to do is where possible, we'll try to link in people from all levels of the organization in some of those discussions and some of that planning phase, because to your point, just because the leadership has a vision of what's practical, if you don't talk to the people who are actually on the ground doing the work, you may have a very different vision of what's realistic. So the more we can engage them in the process of it, the more likely the plan is going to be something that is a realistic plan for everybody in the organization, and the more likely that the people in the organization are going to feel like this is their plan, not a plan that a bunch of consultants developed and handed to them and walked away. We at Bridgespan, we're a nonprofit ourselves, so we can't really measure our success based on revenue. What we do try to measure, and it's very difficult to do, is measure ourselves on the impact that we have, which is how often do these plans that we recommend or we work on actually get implemented. And so we have a process where we go back every 6 months to organizations that we worked with to see whether or not what we recommended worked, and if it hadn't, to try to understand what happened. It doesn't always work perfectly, but it is definitely something that's top of mind for us.
Hi, Hillary Baller, Yale School of Management and Yale Divinity School. This question is also for the two of you. You spoke both a little bit about competition and the way that the nonprofit sector thinks about competition within the industry. And then, Sivan, you specifically talked about growth platforms such as branches, affiliates, and licensing models. I'm just curious about nonprofit M&A, since presumably if the sector is bloated, if a lot of people are doing great work, but they're replicating the same work, there could be some ability to consolidate the efforts. And I'm just wondering whether on an engagement basis, this is something you're seeing, whether this is a trend that's happening at all.
So right now I'm personally involved with 3 of them. So it's happening, but kind of the biggest challenge to them in the nonprofit sector is that when you have a merger, you have an acquisition in for-profit, those executives walk away making an awful lot of money. And so there's a huge incentive to make it happen. In the nonprofit sector, you have the problem of ego, frankly. And you have 2 leaders.
And no money.
And no money. And you have 2 leaders who love their organizations, and who gets to stay in charge, and what boards get to stay, how do these boards mix? And that becomes the real kind of barrier for making these mergers happen. We've seen a couple of foundations work to try to put money into the pot to try to incentivize some of these things. So there's a trend going into that direction, but really that's what makes it hard.
This question is for both of you as well. Courtney Drake, Yale School of Management as well. And can you just give some examples of some of the most successful scales that you've worked with in your consulting career and identify some key factors for success?
That's a big question. It's a big question. So I think that the organizations that I work with more personally are local organizations that are within this area. That's part of my role in terms of the social impact node role. So I wouldn't want to speak to a judgment of a global organization and say X is best at what they've done in terms of scaling. So our level of growth discussions are really at that U.S. level. Really, it's not going international or building affiliates or governance in that space.
There are a lot of them, and I'm not sure this is the right venue to walk you through all of the work that I have done and that our firm has done, but if Bridgespan, unlike a for-profit firm, has the benefit of being able to be very public about the clients that we have and the specific work that we've done for them, and it's all on our website. So Harlem Children's Zone and all of these organizations that we've helped scale up are all listed there with the exact answer to your question as to what made it successful and some of the challenges they had. So I think you'll get a much better breadth of everything if you look there.
Hi, my name is Jeff Felinsky. I'm at Columbia Business School in the School for International Public Affairs. Jeff, you brought up kind of the human capital crisis, and Sivan, you used the term leadership gap. If I could ask you to just put on your visionary hats for a second, but what do you think it's going to take to get rid of that crisis, to close that gap? And what is it going to take to steer that Oxford MBA or Ivy League undergraduate away from, the investment banking and consulting recruiters that are standing in front of them, waving their hands? Because moving forward, I think, scaling up depends on that.
I would almost ask that question back to all of you.
Well, can I take a stab at this one? I'm not so convinced about that gap. We've heard about it, but when you look at it, we're finding there's a flood of people coming in from the for-profit sector, and there's an interest there that is unprecedented, part of it driven by the economy. Whenever we see people, when we see jobs coming up and people, there's plenty of applicants for those jobs. The real problem to me is not the gap at the top, because the heads of these nonprofits, for example, they're making six-figure incomes. They're doing just fine. The real problem is at the bottom. It's the line staff, where they barely get minimum wage. They oftentimes don't even have benefits. That's where the real problem is. And they're doing the critical work in these programs. And there's a real resource gap at that end, which often doesn't get talked about. And I think that's really where we have the biggest problem. And the other thing in terms of the scale of these things, this is something that blew my mind when I came to this job. Half of all the charities in this country are less than $25,000 in annual revenues. And they get a pittance of the revenue in the sector. There's a very small number of charities that get the lion's share. They're 0.2%, about 3,000 charities get 60% of all the revenue that come into the sector. They do just fine recruiting. They have plenty of money to do it. There's this group in the middle that we hope are the innovators that can grow up. And I think a lot of the work that we're talking about here is that sweet spot in the middle. But I personally haven't seen it yet. And we've seen these studies that do these surveys. Oh my God, the sky is falling, and then when you actually look at it, the jobs are getting filled. And I think that the growing interest of the for-profit and the MBAs and the social business interest is also helping to fuel that. I'm not quite worried about that. That's just me.
And in South Africa, we've also seen a change in the last 2 years as the economy has dipped. We've seen more people with better degrees applying for higher positions. I'm worried about the sustainability of that for our own organization as the economy picks up again and these guys realize they can easily get a job for 3 times the salary outside of the organization. Nevertheless, I think the two separate issues that you've kind of bundled together that I think is often a problem that I see not just in our own organization but outside, and that is management and leadership. And they're quite separate, actually, in my mind. And management is a subset of leadership to me, actually. To have a good leader in an organization, you need someone, there's a whole field of study in leadership, but you need someone that can have a vision, get other people to buy into that vision, unify an organization around that, understand what's happening at the ends of the organization, but still give the end's freedom to move and kind of execute the operations of the organization. And that's not I don't think that's a crisis in the social sector alone. I think that's a crisis worldwide. I don't see a lot of role models for me as leaders in the world. Certainly not in Africa. Certainly not our president or the previous president. But the one before that was quite good. Nelson Mandela was certainly a role model leader. The problem in our organization, when I said that I'm wondering how we're going to grow into those positions of leadership, was that I can't, as the head of the organization, lead an organization that's in 6, 8, 10, 12 countries. I need my managers who manage the day-to-day operations and make sure that the monitoring and evaluation is done and performance evaluations are done and things are executed. I need them to start behaving like leaders. I need them to now come up with their own visions and their own missions for the countries that we're working in, and then inspire their own teams in that way. And because it's so difficult to find a leader to start out with, it's very difficult to then create a structure. Because otherwise what happens is you've got to become very rigid in your structure. You've got to say, okay, we don't have leaders in the organization, so you have to report on A, B, C, and D, and we're only going to do A, B, C, and D, and we're not going to do anything else because we don't trust the people leading the various parts of the organization to kind of find solutions on the ground and adapt, the same way as I was able to do with the organization when we first started out.
Hi, my name is Shamik Bose. I'm in the School of International Affairs at Columbia. My question is, you've identified the revenue sources to be pretty traditional in terms of grant funding, major donor funding. Do you see a shift or change to income-driven funding or revenue sources for nonprofits?
I think it's starting to go that way. I can't wait for when it really starts going that way. I think right now it's trendy and hip, and there's only a small group of them that can really make that happen, but it would be incredible if that was a way to drive more money into the sector.
I would agree and echo that. I think that it's been something for a few years now that I've been hearing is more social enterprise and an interest in being able to have different streams to maintain your own mission and your organization. And there's trade-offs for that. I know there are trade-offs for some organizations that want to do that and lose sight of what it is that they're supposed to be doing or want to be doing. So you lose a little bit of reputation. There are ways of doing it right as well. And some organizations that we've seen, I think the arts is a good example, and some museums in New York we can think of that do that quite well. But certainly I think it's still something that's growing and will not be the norm for everyone.
We'll have the last question.
Hi, my name is Maria. I'm a student from NYU. Saul, I have a question for you. Regarding the scale up of your organization, which has been like the key alliances that you have been doing? Alliance, like for example, public-private alliance or any other actors that have been helping you to scale up your organization?
That's quite a difficult question to answer, because the way we kind of bill ourselves is as one cog in a very big machine. So in actual fact, we can't really remove any of the other cogs in the machine, otherwise the whole thing would stop turning. Certainly, the first alliance we had to build was one with the government, because we're working in public sector. A very valuable alliance for us was bringing on board the ideas, and through the ideas, the people who are actually working in rural areas, the healthcare workers in the rural areas, through rural doctors associations and other associations of these healthcare workers. They're the ones that actually know the information. I said we've got professional recruiters running recruitment. They certainly don't know much about rural healthcare. So we need to have people that are professionals in what they do, but open to bringing together and intersecting a whole lot of different ideas. So we needed to get that group on board as well. And that was an extremely important alliance partner. And then outside of the government and essentially the beneficiaries of our work, it sounds strange, but we had to create an alliance within the team, a kind of a unification towards a single vision, and it was very fragmented at the start. especially after the merger, and especially as we started hiring and growing quite quickly from 2 to 40 people. We've learned our lessons. And so we had to treat each of our individual staff members as people who we had to get their buy-in as much as we needed the government's buy-in. Otherwise, we couldn't trust them to go out and do the work that the organization's mission was meaning to do. We managed to align things by calling ourselves a social profit organization. Instead of framing ourselves in the negatives as something we're not, we are not profit. We're actually framing ourselves as something that we are, a social profit. And we certainly are profiting Southern Africa, just not in a financial sense. We're profiting in terms of the social benefit that can certainly be measured. And that was a way for us to bring everyone on board and get everyone to focus towards what we are doing rather than what we're not doing, which is trying to make profits.
Ken, key alliances? Do you want to?
Key alliances. Well, the Alliance for Effective Social Investing is probably the key alliance for us, is to get the thought leaders in the sector and use their influence, their wisdom, and their support. That's been critical to us. And we've actually engaged them, in addition, as an advisory panel, a smaller group of them, as a manageable number, to respond to prototypes of each of the tools as we go forward. That's also been critically helpful to us.
All right, thanks for coming. I, as a journalist who covers social enterprise and the not-for-profit sector, I'm looking forward to writing about your stories. So go out there and do wonderful things. And join me in thanking our panelists for this discussion.